One of the most prevalent sexual transmitted diseases is genital warts. The virus that causes genital warts is human papillomavirus, HPV, infects nearly everyone who engages in sexual activity at the same point of their life. Today I want to talk about the HPV. Stay with me until the end. Welcome back to my YouTube channel. My name is Rezvan Shekarchi. I'm a psychosexologist, and by producing video I help you to have a better knowledge about your sexual and emotional life. If it is the first time that you are watching my channel, please don't forget to subscribe and push the button so you are always in the first row for the next video. Tissue of the genital regions are affected by the genital warts. It may appear as relatively minor fleshy bumps or as a cauliflower. The warts are frequently so small that they are not so visible. Genital warts are one of the possible side effects of the HPV types, while cancer is another thing. Vaccine can help to protecting against some groups, so don't undervalue the significance of vaccination. Genital warts can develop on the cervix, on the anal and the external genitalia, the vaginal walls on the edge, and the regions between the external genitalia and the anus in women. And also they can develop on the anus, scrotum, and also tip of the penis in the men. After engaging in oral sex with the infected person, genital warts also can occasionally appear in the mouth or the throat of the infected person. Your genital regions may experience minor fleshy brown or pink swelling. The proximity of the several warts brings a shapes of the cauliflower, discomfort or itching in the genital area, or bleeding in the sexual activity. Also, warts on the genital area could be so small and flat and they are not understandable and detectable. However, genital warts can grow and have a significant problem in the group of people with a weakened immune system. When to see a doctor? If you and your partner has the bump or warts on your genital area, visit a doctor before it's getting too late. The HPV virus can brings the genital warts. More than 40 different types of HPV can harm the genital area. Sexual contact is almost always the way of the transmitted the genital warts. Vaginal sex, anal sex, and also oral sex are the way of the transmitted the HPV virus. Your warts doesn't need to be so visible to infect your partner. The majority of the people who are sexually active eventually contact the genital HPV before they know. Having unprotected sex and also having the different sexual partners are the things that can arise the risk of the infection. Having the additional sexual transmitted illness make you to be more in danger. Also, having sex with a partner that you don't know about his past, his experiences or her experiences in the past make you to be in danger with this virus. Also, as I told, the people who have the weakened immune system are more in the risk of getting this virus. Cervical cancer is closely linked to the HPV infections. Certain types of HPV are also linked to the cancers of the anus, penis, and also the mouth. HPV doesn't always lead to the cancer, but women need to have a regular pap smear, especially those infected with a high risk of the HPV. The virus cannot be transmitted by toilet seats, swimming pools, shaking hands, and so on, but it could only be transmitted during the sexual activity like anal sex, vaginal sex, oral sex, but in somehow without any penetration also can be transmitted. Why? Because the skin to skin touch can increase the way of the transmitted disease. So even without sexual activity, you can transmit it or getting the virus. How you can protect yourself? Vaccination. 3 HPV vaccines are approved by FDA. The latest, Gardasil number 9, is supported for use for both men and women between the 9 to 45 years old that can protect against the cervical cancer and also the genital warts. CDC recommended regular vaccination in boys and girls with the age of the 11 and 12 years old. Although the vaccination can be done from the 9 years old, which is the ideal year for the girls and boys. But if you are after the 13 years old, also can inject the vaccine. For those who are in the between the 9 and 12 years old, recommended for 2 doses of the vaccination. But for the people after the 13 years old who wants to get the vaccines, recommended the 3 doses of the vaccination. Points which is good to know. HPV is one of the most sexual transmitted disease. Most of the men and women who are sexually active in some period of their life may be affected by this virus. Unfortunately, still there isn't any treatment for this virus. And also you should know that if you have the HPV, it doesn't mean that for sure you will have the cancer. Most of the HPV who lead to the cancer can be protected by the vaccination. I appreciate you stay until the end. Please, if you think this information can help some other people, don't forget to share this video with them, and also don't forget to subscribe for the next video. See you soon.